Peel became the first Ontario region, soon joined by Toronto, to close businesses temporarily that have 5 or more cases of COVID-19.
At last count, we have almost 400 workplace outbreaks in the region of Peel. So we really need to get ahead of these variants by closing, investigating, and then trying to make sure that those workers in our community stay safe.
At a big employer like Canada Post, cautious support among workers for additional safety measures.
The way things are going right now, I think it's the best bet.
It's best for the workers that can go home to recover. The only question remains, of course, is will they be paid sick leave benefits?
A growing chorus has been calling for paid sick leave benefits as Ontario doctors ferry patients between hospitals and as bed space has expanded in 2 field hospitals. Even the co-chair of the science table that advises the government has called out the government.
People should not have to choose between keeping food on the table and keeping others safe by staying home.
Today, the science table issued a public statement that Ontario is facing its most challenging health crisis, calling for essential workplaces only to be open and that essential workers should be paid to stay home when they are sick, exposed, or need time to get vaccinated.
The paid sick leave, the most important measure to have a developed country like Canada without paid sick leave seems unbelievable.
Ontario did have paid sick leave. 2 years ago, the Ford government repealed a law that included 2 paid sick days, a law the Premier then declared was a job killer.
We want to make sure that Ontario is open for business.
That was then. Now?
What they need is paid sick days, paid time off when they're sick.
Pounded by the opposition, the government said it hoped the federal budget would help out, but now the province is signaling it may bring in paid sick leave.
I want to assure every worker out there that we have their backs and we're going to be there for them until we defeat COVID-19.
Paid sick days only make sense to those working in congregate settings.
People, they get scared when they don't have an income, so it forces them to go to work even though they know they probably feeling symptoms or they're not well.
If essential workers are paid to stay home when they're sick, epidemiologists say it will make a difference. Eric Sorensen, Global News, Toronto.